turn on your mics.
Okay, good afternoon, everybody. This is the Thursday, February 16th, 2023, 4 p.m. Board of Health meeting. Just like to remind everybody that this meeting is being recorded by video and audio. And for those of you joining us remotely, please announce your name when you're called upon and use the raise hand button, and myself or Roberto will call you as we see your hand. Could I get a roll call vote for board members that are here? As I see you, could you just announce that you are present? Jim Cooper.
Here.
Meredith Lepre.
Here.
Is Brooke on or not?
No, Brooke isn't going to be on, and I guess Malcolm didn't make it. So.
Okay. Carrie McKenna.
Here.
Okay, thank you. Steve Visco's here. Is there anything that's not on the agenda that anybody would like to talk about? And I see one person in the audience, Mr. Curtis Barnes.
Good afternoon, Curtis Barnes for the record. I'm here to ask or make two requests to the board. The first one is I am requesting that you reduce the rental registration fee from $250 to $150. And the reason is that there are 2,000 registered rentals. At $250, that's going to produce $500,000 of income. And according to Mr. Giorgio, you can't charge more than the cost of the service as a fee. I do not see any reason whatsoever why the cost of implementing this program should be $500,000. And I think at 150, you would have 300,000, and that should cover it adequately. And I also raise as part of that question whether the Board of Health has contracted with GBI and Granicus for services, which I think are being attributed to the fee. From my perspective, those are town administration contracts, and therefore they should not be part of the fee. But even if the town tries to roll them in, I think the fee, as it's stated now, is excessive. So I request first that you reduce the fee to $150. The second request is that you, if you can't make an ordinance, maybe you could pass a resolution that every rental property needs to be registered, as it is in Barnstable and Yarmouth. And today's paper proves the point. Richmond wants to have the town take care of the parking due to the excessive crowding, overcrowding of those units. And my son inspects them as a HERS rater. He knows that a 2-bedroom apartment has 8 or 10 people in it. And it's ridiculous that we are registering short-term rentals where you have virtually no complaints, and most of your health department complaints are from year-round rentals, and yet they're not required to be inspected. So I submit that the board should say something about that. And as I say, if you can't pass a ordinance that make it happen, it has to go to town meeting, at least you could pass a resolution recommending that ought to take place. Thank you very much.
Thanks, Curtis. Roberto? And
We can move on. We will take these under advisement.
yeah, thanks. So,
It's not up to me to set the
right.
It's not up to us to set the fee. It's not up to us to change the bylaw. It was put in by the select board. So I can pass this along.
Yeah, and just on top of that, I know we're trying to move towards that, Curtis, and it's been a long, if you remember, Richard Ray tried to get it done years ago, and it got shot down at town meeting pretty heavily. But we know and understand here that it should be every rental, not just short-term rentals. And we're Roberto said in our last meeting, we're trying to move in that direction.
Well, I just heard you say that the select board set the fee. I thought you recommended the fee and
If you remember, it was a joint meeting. We cannot pass this regulation without the select board's vote.
the fee, you can't.
Both. We can't change the fee to this because it's set by the regulation.
Okay, I'll go see them next week and say this.
I'm already giving an update on the STR, so feel free to show up.
Thank you.
Thank you. Okay, we'll move into Roberto's director's report.
So just the three quick updates on the director's report there. One is actually STR related. We did the Granicus training for host compliance software yesterday. So now that was the last step from our side to get this up and running. So now we're just waiting on Granicus to give us the go ahead to have the website go live. Once Granicus puts the website live, we can start registering short-term rentals for this year. Again, as the regulation states, registration has to be done by November 1st, and we'll start enforcing on January of this coming year. Using a rural health equity grant, we are funding an intern for this summer. If things go well, hopefully everything gets approved. This intern is coming in from Queen's University from Belfast in Ireland. She already has housing on island from a family relative, so that's going to be really good. She's going to be helping us with everything from aquaculture to some of the agricultural inspections and food inspections and things like that. So we'll be working with the Natural Resources Department and sharing the intern with that. So we're really excited to see that moving forward. And then lastly, as we were discussing right before the meeting, we are working with the Visiting Nurses Association. We received a contract last week that we're looking into to expand our maternal child health home visit program, but also to increase the home visit program across the board. So everything from direct observation therapies for our TB patients to even wellness visits for postpartum follow-ups. So we're actually really looking forward to a lot of to expanding what public health, community health, and public health is. Unfortunately, we are going to be losing our current public health nurse. She did lose her housing on island, and she's moving down to part-time now. So next week we should be posting the full-time position, and we'll have a new public health nurse hopefully by the end of next month. And I believe that's it for this one. This increase of the community health part, if you remember, and actually for Carrie as well, was one of the primary parts of our strategic plan, our 5-year strategic plan that we voted in 2017 and got derailed by COVID. We're finally back on track to getting the community health side up and running.
Great, thank you.
That's it.
Some questions for Roberta? No? Okay, thanks. Okay, review of the minutes. Any additions or corrections?
I'm good.
I get a motion to approve.
So moved.
Get a second?
Second motion?
I think Carrie seconded.
Yeah, seconded.
I wasn't at the meeting, so I don't think I
Oh,
can vote.
okay. Did Carrie second it?
Yes,
Carrie, did I hear you seconded on the?
yes. Am I coming through?
Oh, we can't hear you. No, you just remuted as well. Carrie, you're showing up as muted.
Okay. Second motion? Am I coming through?
Yeah, we can't hear you, Carrie.
I mean,
I don't know what's going on. Because you're showing up as speaking, it's automatically going to you. So your microphone is picking up, but for some reason we can't hear you.
yeah.
There
let
you
me-
go.
We got you.
There, we hear you.
Okay,
now.
I shall talk louder. I would like to second that motion.
Okay, all in favor by roll call vote, Carrie McKenna,
Yes, approve.
Meredith Lepre.
I just can't. vote.
Oh, that's right. Sorry. Jim Cooper
Yes.
and Steve Visco says aye. Thank you. Okay, next we have a variance request for 5 Bank Street, septic tank and soil absorption system property line setbacks.
Yes, this is a big sick upgrade from a cesspool up to I believe an IA, right? Sorry, no, I'll just let Art do the whole thing.
Okay, thank you. Arthur Gasparo, Nantucket Engineering, here to request the upgrade, as Mr. Santa Maria said, from a cesspool to this is actually a conventional system.
Conventional.
We're down in Codfish Park, so we're not in a nitrogen sensitive area. It's a somewhat unusual situation we don't see a lot of, in that there's serving one of those small 1-bedroom cottages. And we're not asking for any increase of flow. So we need relief from the board to allow us to install a 1-bedroom system. We're also requesting relief for setbacks to property lines where at its closest point, we've got it about 4.8 feet. So we've asked for a reduction of setback to no less than 4 feet, just in case in install, there's a little shift of a 1/10 or 2 or what have you. And then finally, the depth over the system would be slightly more than the allowable 3 feet at about 3.7 feet. And again, that's to maintain a gravity flow out of this system. It doesn't make a lot of sense it's about a 2,400 square foot lot to try to put a pump chamber in. Finally, we are going to work with staff. We did a soil evaluation with a backhoe, but it was caving extremely to a point of being dangerous, that we were only able to get about 9 feet, and we need to get prove about another foot or 6 inches. I'd like to get another foot to show there's no groundwater. So we're not asking for relief for the groundwater separation, but we do, before we come in for a permit, just to give you all of the information and address the point that was in the staff report. That and if we couldn't do that, we would either have to come back to you for that relief or put in a pump chamber. But I believe that can be avoided and handled before we apply for the permit. So in summary, we'd be seeking relief for a 1-bedroom system, reduction of property line setbacks to no less than 4 feet, and allow the depth of cover over the system to be 3.7 feet. And with that, I'd be happy to address questions or concerns that you might have with the application.
And then John for the staff recommendation.
Yeah, if you read the staff recommendation, we have no problems at all with the setbacks or anything. It's really kind of a formality through Title V that the neighbors need to be notified. As Art, Mr. Gasparo pointed out, it's an extremely small lot, and it really needs to be upgraded by Title V anyways. So yeah, there's no objections about that at all. And we've talked about the groundwater separation, and if he's redesign or we get some more clarification on what we determine the groundwater to be there. So
Any questions for Art or Jim?
No.
Okay. Can I get a motion to approve the variances?
I'll make that one.
Can I get a-
Second,
Okay, all in favor by roll call vote, Meredith Lepre,
yes.
Jim Cooper,
Yes.
Carrie McKenna,
Yes. Yes.
There we go.
Yeah.
Yes.
okay, and Steve Visco says yes.
Thank you.
Thanks, Art.
Carrie, good move with the sign language that worked.
That's-
Okay, next we have needle exchange program.
Yes, so this one is a very straightforward ask. The Health Imperatives Group is looking to start their needle exchange program, and they can't start it without approval from the Board of Health. So they did request, they did send in the the proposal. Us as a staff, we have no objection to it. We actually think it's really good. We also have the needle disposal machine at our property, so we will also be in partnership with them, taking all the dirty needles, dirty used needles off people's hands, and we'll be disposing them and making that inert, properly disposing of all the needles. It's a great partnership, and we have no objection to it. All we would need is an approval of the needle exchange program so that we can go back to them.
And you have the receptacle where?
Yeah, the receptacle is at our property. We do needle destruction at 131 Pleasant Street, right in the garage.
Okay.
And then you would give people clean needles.
They are, yeah. So they're going to be doing the needle exchange at the Health Imperatives site, and the sharps containers will be disposed of at our property.
Do we need like official?
We do need an official vote because they need to send that to the state in order to get approved.
Okay, can I get a motion to, go ahead. Motion to
Motion.
accept the needle exchange program?
Motion to approve the needle exchange.
Second.
Okay, all in favor by roll call, Meredith Lepre,
Yes.
Jim Cooper,
Yes.
Carrie McKenna,
Yes.
and
Perfect.
Steve Visco says yes. All right. Next, well regulations discussion.
Yes. So one of the things I actually have to share the screen here. So give me just a moment. Here we go. So at the December meeting, we had an issue with the private wells about a loophole in the well regulation about setbacks with the Noshawn Way variance that was given. So we had the discussion last month. Carrie did request that we put this on the agenda, and I agree because this well is more than a tad bit antiquated. So what we're looking to do is starting to update it and close those that loophole specifically, but also since we're looking to look at this well, that this regulation as well, we did get a request from the PFAS group to also look into adding some sort of a requirement to do PFAS testing, whether it be at property transfer or kind of like Title V inspections. So we would now start requiring it in the regulation. So I wanted to throw that out there that we're looking to close that loophole. We're looking to do add the PFAS to this regulation specifically. But also I wanted to bring it on to the agenda today to get comments from the board of, is there anything else specific that you would like us to also alter and fix? I can put this on next month's agenda as well. But I'm hoping to shoot for a public hearing to start that discussion in April, maybe even May. And then I'll also need a vote from the board to request town council to review any of the alterations that we do.
In the meantime,
Mhm.
what are we doing if people come in and apply for that?
We have to go by what we,
Okay, so
That precedent that we
means
set.
The sooner we get this thing done, the better off we are.
correct.
So the loophole that you're alluding to is what we had through
In-
26 Nosham Way. And the intention of the regulation wasn't to stop people from making improvements on a property. But it seemed like there was a lot of concern with the new construction.
Correct. So
Right.
we would have to clarify the new construction trigger here versus improvement. That's
Okay.
one of the things that we're looking at.
And I'm kind of glad Art's still here. I mean, you deal with this every single day?
Yes, I'm
Mhm.
happy to just say I would look forward to the public hearing, but I would respectfully say I'm not sure I would refer to it as a loophole. I think that it was, and I know it's maybe semantics, but
Yeah.
perhaps a clarification. And I did follow the Noshawn Way. I wasn't involved, but my interpretation was, it always has been, and 25 plus years of dealing with that regulation. was that when you had lots that were created prior to the effective date of those regulations in 1990, that it didn't apply. And that when I say didn't apply, the extended, if you will, well protection zone based on the direction of groundwater flow. I'm not so sure that should change more than the language in terms of helping the staff have clarification and that what qualifies versus doesn't qualify or have to come to the board. But if the lot predated the creation date of the lot was prior to the effective date of the regulations, then, you know, trying to change that so that it would apply could, you know, render essentially some lots so that they may not be buildable essentially. And I think that's a pretty large reach and change of regulation that you might want to consider, you know, pretty closely. And again, I understand wanting to make some changes to the regulation if needed in terms of clarification, but I think I would hope there wouldn't be a sort of a wholesale change or look at it that shouldn't happen. You're still providing the separation required by Title V, no matter what, for 100 feet. And honestly, the groundwater flow direction, that whole basis based on the Horsley-Witten groundwater map #2 of, I think, 1978 is less than perfect. You know, it's fairly challenging to interpret the groundwater contours. I think there's a lot of subjectivity to that. And I think that the board, and maybe this is better for a public hearing, but if you've asked me, and if before you craft those regulations, I might just caution that if you're going to do that, you might also want to look at then maybe an updated map in terms of groundwater contours and how that groundwater direction is determined. Because if you're going to possibly through this regulation and then something that might have been buildable isn't buildable, and one person's going to say that one expert's going to say that using their interpretation of that groundwater map is that it's not in the zone, and someone else's, I mean, it's far from exact. And then you've got the dome areas as well. So I think there's a little bit more to it that I would offer in terms of looking at that.
This is actually all great information, and I've been writing it all down. We will have to put all the changes and discuss them openly here before the public hearing anyway. So would you be amenable to?
Along and happy to meet with you or whatnot.
Perfect.
Happy to help. Thank you.
Thanks.
Thank you.
And, you know, I remember Roberto, we were talking just exactly what he said at the end about, you know, we're relying on a map that was done
That's
33 years ago. And today's technology and stuff, I'm sure it's.
So as far as the groundwater map goes, there's two things in the works there. One of them goes where a lot of the well work is going to get affected by this new Title V coming down the line. So we won't be able to vote in a new well regulation until we see how it jives with that. We don't want to release anything that conflicts. And then also we did have some work. So USGS was here not long ago working with Mark Willett to remap all of the groundwater and the aquifers. So we have more accurate measurements. So we've been having a lot of discussion, especially along the lines of this PFAS discussion is really what triggered a lot of this discussion to see how it actually affects these sorts of well regulations. So from a PFAS perspective, more so than in a septic system perspective, I would say but us, the town, is in the process of putting out more accurate data than at this point, 37-year-old report.
Yeah.
Based on 47-year-old data. So.
I would be super interested to see the new groundwater, the water, because I think that when the PFAS stuff came out, the airport did not think that it would be where it was. And
Exactly. And with the new technology that's out there, so there's the dome sections that you were talking about, but also there's a little bit more clay than we expected. has created some splits in the groundwater flow that we didn't know before. So that came out because of the airport review. So it's an interesting thing, and it's time that if it wasn't for what happened for that December discussion that triggered this, honestly, I don't know when we would have looked at this well regulation again. So in many ways, we can thank Mr. Bracken for bringing up that variance request that brought this back to the forefront. John.
I guess my interpretation would be, because that whole scenario was new construction on a lot to add, well, it was expanding the leach facility on that property, which was being improved. So the reality is, what I believe, what I think here is, this is a well regulation. So this is the placement of a well. So this isn't restricting someone from improving a lot. This is the location of where their well is. And if it's pre-1990 well, and they can't meet the 300 zone by putting this well in, we'd grant that property relief, or they'd be exempt by this regulation. I think having an abutting lot that's doing new construction and increasing the leach facility, which is non-compliant, meeting that 300 zone is a different thing. That's my opinion on this. So I think it's a little bit maybe confusing, or it's too moving parts here with wells and soil absorption systems and their locations. So, but I mean, as I look at this is specific to wells and well placement. So.
Would there be any wording in this new thing if there was town water available? Would that have anything to do with it?
We can definitely look into adding that as well. Right now, the well regulation doesn't even address that. So we can look into adding anything, scenarios. This is our opportunity to completely revamp the well regulation.
I'm not
Yeah,
saying.
I mean,
could you?
Like I would say you shouldn't be able to
No.
drive a well for potable water if town
Exactly.
water is available, and should have been
And
on there for a long time.
if you remember, we actually looked into doing that with Regulation 78.
Connecticut.
Yep. And all that. So this is the opportunity to add, remove, alter, clarify, close loophole, however we want to use the wording. This is the opportunity to do so. That's why I said, if you have anything specific that you would like to see change, and I see that Kerry also has his hands up. If there's anything that we're like to see changed, please send me emails, send me any updates, send me anything that you would like to see in a new regulation for the wells. I know the PFAS thing is a big portion of it, and we're probably going to end up having to add an entire subsection because of emerging contaminants. And it's not just PFAS. So moving forward, to prevent what happened from happening again, where we have this period of, we know this chemical is there, but we can't do anything about it until water gets there. So in the meantime, you get POET systems and drinking water bottles. That sort of interim solution, in my opinion, is unacceptable. So this would be an opportunity to add emerging contaminant language to move forward. And then we go from there. And I see.
Kerry?
Yeah, can you hear me now?
I'm sorry?
Am I hearable? Can you hear me?
Yes.
Okay, good, I fixed something. Okay, I guess there were two thoughts. One, going back to the discussion in Nashan, we talk about old regulations, and that regulation in 1990 was addressing issues that existed in 1990. A lot of our concern was that that's not the situation that was being addressed by the Nashan way thing. Because again, we talked about Nantucket adding a room. You have a person has a baby, you want to add a room, and you have limitations. Where this really was taking that and multiplying it exponentially. And I know I personally, I don't think I was the only one that had a little bit of a problem with that interpretation that, well, they're the same thing. So the conditions in 1990 that caused that regulation to be written are not really are not the same as adding several bedrooms and a pool and that. So that was a side part of that discussion. The other thing just getting to do with the potable water, so like, and I'm going to use Nantucket because that's where I live. If we do add that, which I think is good, is there a way that the folks out like on some of the private roads out there can work with the water company and the town to get it? Our street at Arkansas Avenue lies between two water lines, but we don't have any water. We don't have town water on our street because it's a private road. So I think my understanding is there is a process for owners of private roads to petition the water company or the town. And if we do go forward with that, I would like that we make those processes knowable to people so that we can encourage more access to potable water, the town water.
Absolutely.
Yeah, absolutely. I think there is a process. The last section that was done out there, that's every homeowner, because they were private and butters ways, had to sign off and give the water company the easement to put the water in, and then they did, if you remember, down Columbus and
Midland,
parts of Midland.
Yeah.
Yeah.
So just, that we make that, if we're going to put a regulation in that encourages that to also promote the process to, make it happen. So there's not like, yes, there is a process, but, people don't know about it. So just that would be part of the education of the around the regulation.
Absolutely. When we talk, so Mark is part of the Water Coalition with Natural Resources, Land Council, Mariah Mitchell, the Shellfish Association, the Sewer Department, and us. So through that process, one of the things that we've been discussing is how to make information more available. And this is a perfect example.
Yeah.
So
Thank you.
with this, will the health department be offering the PFAS testing as if it similar to the other? I mean, I think if we're gonna, and I think it is a great idea to require people to test their water for PFAS when they're selling it. But I also think then it should be made available because it can be confusing and there's lots of labs and you don't.
As of right now, the Barnstable County Lab doesn't do PFAS. I know they're looking to add that. Last I spoke with Sean O'Brien. I don't know how long it's going to be before they do add it. However, it is not hard for us to be able to carry bottles for other laboratories. Unfortunately, though, the property owner or the representing real estate agent or whoever is going to be doing this test will still have to do just like we do with Barnstable County, where they have to provide their own payment and things like that.
Yeah.
And I think this is a great idea.
Yeah, and I think it's just a matter of making it more available.
Should we be talking to include the water company to sit in this to find out if in the near future they have any plans on expanding
Absolutely.
water to places that don't have, that might be?
I can ask Mark to provide us the what the expansion plans are, because I know they're looking at certain areas over others. Right now, they have to bring water out to the west of the airport. That kind of jumped the line to the front of priority, but I don't. But so I can definitely ask Mark to provide
I
that
think we
information to
should.
us. Yeah, absolutely.
Okay.
Yeah, he's trying to be as transparent as he can.
Yeah.
On what his expansion
We
is,
don't
but
even
unfortunately,
trying to think of sneaking something through here.
exactly. Yeah. So I don't want, you're absolutely correct. I know, certain situations change the priorities.
Yeah.
The PFAS west of the airport was the perfect example. I know that expansion in Nantucket was on their, or is on their horizon. I just don't know what their time horizon is.
Well, if we have them involved in this, they might say, well, maybe it's a good time to do it rather than wait.
Absolutely. I'll include Mark. And in the meantime, please look through the regulation. Send me any emails, any wording that you're looking to see changed, any suggestions that you would like, and also for the public. So Art, if there's any specific things that you want to see fixed, or if there's anything you want to see that we don't want to go away, or that if we do any changes that might accidentally make things worse, that's what we're trying to avoid here.
Yeah.
So when will the public meeting be?
At this rate, we'll be at this rate if we get everything done and we get everything on the line and agreed upon, the Board of Health hearing would be May, the third Thursday in May.
So how do we get all this information out to the public? Are we going to put something in the paper?
We have to put in, we were not
No, but
even.
I mean, more than a little clip saying there was going to be a public meeting.
So with the new public outreach coordinator, who is hopefully going to be starting sometime soon, that person is actually tasked with to take a few departments. We're one of those.
Yeah.
So we'll be working with that person to get
Okay.
the information out as much as possible. Right now it is just for NCA, but there's so much outreach that needs to be done. They're giving her a staff.
Any other discussion? I'll reach out to some of the other surveyors and engineers too.
Yeah.
And
Okay, good.
just tell them to take a look, and if they got anything, put something together.
I'm sure the water commissioners would be more than happy to look into this as well.
Anybody have any other questions on this?
I'm good.
I'm okay.
Anything else anybody wanted to talk about?
Not me.
No?
All right.
You got a lot
Okay.
of work ahead of you, boy.
Yes, we do.
Okay, can I get a second?
Second.
All in favor by roll call, Meredith Lepre, Jim Cooper,
Yes.
Carrie McKenna,
Yes.
and Steve Visco says yes. Thank you, everybody.
All right. Thank you
Thank
very
you.
much.